BRCAStrong has evolved into a sisterhood of purveyors, thrivers, and survivors that offers education, information, support, and advocacy for women who are uninsured or underinsured by women who care. Support comes in all forms, from our post-mastectomy garments and prosthetics to lymphedema sleeves and other treatment necessities, and is provided at zero cost to all of its recipients. We offer programs to guide women throughout their lifetime with physician-featured educational Zoom calls like the one you see this evening, online surgical resource guides, online checklists to prepare for surgery, information on types of breast reconstruction, term glossaries, because we all need those, a private support group where we can go to obtain educational resources and community support, as well as pre-surgery mastectomy bags and post-mastectomy garments and lymphedema sleeves. This group is supported through philanthropic donations, both financial and in kind. And, we're here to support each and every one of you. And our vision is really to build a sisterhood within the sorority that no one wants to be a part of. And that's why we're here today. I want to take this opportunity now for all of us to get to know each other a little bit. So tell each other who we are, maybe where we are, and our diagnosis. Again, my name is Tammy. I am Tammy Aon. I'm a single mom. I think somebody has to put their self on mute. Yeah. I'm a single mom, BRCA1, two-time ovarian cancer survivor, and I had a bilateral preventative mastectomy with latissimus dorsi flap reconstruction. I've been a part of this community for a long time, and it's been a phenomenal resource for me. So I'm excited to see so many of my sisters here today. I'm going to go ahead and move on to Toby so she can introduce herself and then keep going.
There is.
You're on mute.
Hi, I'm Toby. I'm Tracy's younger sister, and I'm here to help support and take up the slack of these girls that all work on a full-time basis. I retired a year ago. I'm here for them. I support them, and I watch all their journeys. Thank you, Dr. T, for being a very strong supporter of BRCAStrong, and we appreciate all the time you put in for us.
Thank you, Toby. Laura, it's great to see you here. Tell us who you are, where you're from.
Hi, I'm still sorting out my technical things. Hi, I am originally from California, but my husband and I just recently moved to Colorado. And then about a month ago, I learned my BRCA2 status. So I am currently just learning a lot, and I'm just here to hear everyone's stories, and I'm sure there's a lot I can learn from you all.
Well, thank you so much for being here. There's another Laura Kraus on the call.
Yeah, I'm from Ohio, and I had breast cancer with SGAP from Dr. Trahan. So
great to have you here.
Laura.
Yeah.
Maggie Allsworth.
Hi, I'm Maggie Allsworth. I'm from Wellsville, New York. It's a little podunk town about 2 hours from Niagara Falls. We're in the middle of nowhere. Fortunately, after some hiccups, after finding out I was BRCA1, I was blessed to be one of Dr. Trahan's patients and be restored, so to speak. So there's a reason that we've all been brought together to share our stories, and some stories are a little more difficult than others, and hopefully that we can be positive role models for each other and lift each other up as we continue down the journey.
Great to have you here. Thank you. Melissa Butters.
Hi, I'm Melissa, and I am in Long Island, New York. I have 2 kids. I am BRCA1 positive. I have already had a hysterectomy with tubes and ovaries, and I am considering a mastectomy next. My mother and sister are both BRCA1. My mom has done both surgeries. My sister did her preventative hysterectomy and nonetheless developed ovarian cancer 2 years later. diagnosed as primary peritoneal, but she just finished her 6th round of carbo and Taxol today. She moves on to PARPs and Avastin, and she is NED as of today. So we're very happy. So now it's time for me to focus on my breasts.
Well, we're happy to have you here. I'm sure Dr. Trahan has a lot of great information for you. I'd like to remind all of you, if you'd like to put your information in the chat, you can download it so that we can stay connected as a community. Join our private Facebook group so we can ask each other questions and learn our terms and things so we can bring that information to the doctors. Jamie Richards, it's great to see you.
Hi, thanks for having me. I'm calling in from Northern California. I was diagnosed with BRCA1 about 6 weeks ago. So I'm a previvor. I do not have any history of cancer in the family. So I'm doing all my research and deciding about my options. And I really appreciate the supportive group I found on Facebook with you guys.
Great to have you. Thank you for being here. And Wendy, my cousin Wendy is here, my BRCA sister and cousin. You want to take off? You're on mute.
Hi, cousin Wendy.
Hi. Hey, baby. My name is Wendy. I am from Chicago. Last year in June, I found out that I was not only BRCA1, that I had breast cancer. In September, I had a bilateral mastectomy and a DIEP flap. It's been quite a ride for me. Very difficult, but I'm coming around. I haven't been here in a while with you ladies. So I'm really excited to hear about what you're going to talk about tonight. I'm right where I'm supposed to be. So.
Thank you, Wendy. Great to see you here.
Great to see you.
Naidu Gonzalez, did I say your name correctly? Yeah.
Yes, you did. Naidu, hi, how are you? Good evening, everyone. Very happy to be here and very blessed and to have Dr. Trahan in my journey then. I was diagnosed with breast cancer in 2018 and I tried natural and it works for a while, but I don't have the gene, but because of a lot of the stress that I have recently, I guess it's that I don't have the gene. It come back and it wasn't the right side. So through the journey, I have a client who it's her name, and I think it's okay to give her name. Many of you know her then, it's Kim Lewis. She was with the same journey and she guided me into NOLA to the breast center. And it was a blessing for me. I think it was my angel. And then I had been blessed then to have Dr. Trahan. He restored me, and Dr. Ordon, who operated me on August, so I'm free cancer. And so I have the phase number 2 in December, so 3 months later. I'm living in New Albany, Indiana. I have 2 beautiful daughters and a husband who supports me a lot. I have a dog, and I have you guys then, and I'm really blessed to be here again and to continue learning with all of you in this journey.
Thank you, Naidu. We're great. We're so happy to have you with us tonight. Rona Katz.
Hi, when I was having just a regular mammography, they found a lump, and surprise, surprise, I was BRCA2 positive. And I had a bilateral, and I had my ovaries and tubes removed. And that was about 4 or 5 years ago. So from then on, I'm doing okay.
Well, we're happy to have you with us this evening.
Thank you.
Lucette, or Dr. Lucette.
Hi, good evening. My name is Aurelie. I'm in Miami. I met Tracy about a year ago, and I have a family history of ovarian cancer. I'm a psychologist here, and I feel very strongly about helping women dealing with cancer and all the type of health issues. And I'm a huge fan of BRCAStrong and all the work that you're doing. So thank you.
Thank you so much for being here. Kate?
Hey, I'm Kate, BRCA2, had all my surgeries, just here to be with everyone through their journeys because BRCAStrong helped me through mine. So Nice meeting you all.
Nice to have you here. And she did mention she's also on our board, so we're happy to have her with us. Mary Glassy.
Good evening. Hi, my name is Mary. I was diagnosed 2 years ago next week with the CIS. I had a double mastectomy, and I found Tracy through another group. So I got double the support. Tracy is amazing. If anybody's new to this group, just know that she'll be there for you and the whole group. And I've learned so much from everybody, and I learned so I could give to other people as well. And I always say it in every meeting. It's bad that I have this, but because of cancer, I met this group. So that's the only thing I could thank cancer for. So thank you for having me.
Thank you for being here. Joy Ovington.
Hi, everybody. I'm here from Athens, Georgia. So grateful to be here. Always excited. What is that? That beeping. Anyway, I have never known about any breast cancer or anything running in my family, but I was getting really big with neck pain, and so I considered a breast reduction, and I did it in January of 2015. And atypical lobular hyperplasia, precancer, stage 0, kind of like LCS, DCIS, was found. So I opted for the prophylactic double mastectomy, and a total of 6 surgeries were done here in town in which I was botched. I did my homework, I thought, but I just researched implants because nobody told me, and I'm not a dummy, just never came across autologous surgery. And the guy had pulled out as Dr. T says, he ripped through my inframammary fold, and it was a hot mess, and capsular contracture kicked in. By the time I met Dr. Trahan, I was a mess, and not just physically. So I'm very grateful for everything that he did. He had 3 surgeries with me in 2019. He's one of my favorite people, and I've met some of the most brave, wonderful people in the world through all of this since I got hooked up with the center. And just the support community on Facebook and the organizations that supported me, because I had nothing, no money, no support, no family, no caregiver. And here I am. So I'm in the front of the pack with y'all to make sure that we turn around and help other people behind us. So reach out if you have any questions.
Thank you so much, Joy. It's great to hear your story. Of course, I'm going to skip over our panelists because they'll have a special introduction. So I'll go ahead and move to Angela Shamo. You're on mute.
Hi, I'm Angela. I'm from Pennsylvania. I just recently started joining all the different BRCA groups, but this week actually was 4 years since I was diagnosed with invasive breast cancer at 40 years old. I had 100% estrogen positive, 25% progesterone receptor positive, and HER2 negative. I didn't really have cancer in my family. I knew some of my dad's cousins and things, but I immediately knew I wanted a double mastectomy. So that's what I did with it. And I had the immediate deep flap reconstruction, which I really, really am so happy about. I didn't know about they said, oh, you probably should be tested because you're young, you're only 40. I have 4 children, and my youngest was 1 at the time. They were 1, 4, 8, and 10. So it's been a pretty hard 4 years, but it's only getting better. I was BRCA2 positive. I found out in April of 2017. So because of that, plus my estrogen positive cancer, I opted to have the complete hysterectomy, oophorectomy in June 2017. All 4 lady parts removed. Best decisions of my life. I'm a pre-viver then for ovarian cancer, which woohoo. And can't get prostate cancer because I'm a girl. So I'm like happy about those two things. Unfortunately, my dad, my mom is negative. My only sibling was negative. So it came from my dad's side, and my dad, a lot of people, there's misconception that it doesn't come from your dad, but it came from my dad. He had prostate cancer and passed away last April. And unfortunately, if he would have maybe known, we would have known sooner about everything. So, I'm happy that I can be here for my kids, and they're 50% chance of being positive. So we're doing everything to keep going strong, and it's been a big journey. So thank you for including me, and I'm trying to learn everything I can and keep helping others.
Thank you, Angela. It's so good to have you here and to hear your story. We only have a few more people to introduce before we get into our program. And this is a wonderful community, so we're all here to support each other. Suzanne Brazovic, did I say that right?
Well, you're pretty close. We'll let that pass.
Okay.
Hi, Tracy. Hi, Dr. Trahan. Hey, I am a recently reconstructed completely patient of Dr. Trahan's. I was diagnosed with breast cancer almost 2 years ago and started my journey at NOLA in August of 2019, and just finished with my tattoos a couple of weeks ago. And I'm very, very grateful to Dr. Trahan for his expertise and his artistic ability.
Well, thank you
so
much.
It was a challenge.
Yeah. Okay, so let's see. Thank you for being here. Marisol Meeks.
Yeah, hi. So I just had my phase 2 with Dr. Trahan in December. I had a double mastectomy in January of 19, had invasive ductal, invasive lobal, went with implants, had chemo, had complications with those implants, and last year found Dr. Trahan and decided to take them out, which was a really great decision, because he had found actually a large amount of breast tissue that wasn't even removed the first time around. So that was something that I had brought up to my doctors for a year, and everyone kind of like just waved me away like it was no big deal. And that in itself, just knowing that that's gone, knowing that I'm a BRCA2 carrier, it's just unbelievable. But I just thank him for everything that he's done, and doing great 2 months later, and just happy to be here.
We're happy to have you. Thank you so much. Monica O'Kane.
Hi, I'm Monica. I live on Long Island in New York. I was diagnosed with BRCA2 back in the beginning of July. About 4 hours later, I knew exactly what I was going to do. I wanted to have my breasts removed, and I wanted a hysterectomy. I had a deep flap reconstruction in New York with Dr. Jonathan Banks from NIBRA, great doctors over there. I had phase 2 of my reconstruction as well as my hysterectomy back in September, 3 months ago. I missed my follow-up appointment 3 weeks ago due to a snowstorm, and now I'm going to miss my next follow-up because I have COVID, unfortunately. But I have a history on both sides of my family of cancer. My mother's side was breast cancer, ovarian cancer, and pancreatic cancer. And my dad's side was colon cancer and numerous other cancers. So my sister just tested positive. I really, I'm trying to encourage all my nieces to please get tested. And I have a few that are too afraid to be tested. I have 2 grown sons. They have not been tested yet. When the time comes for them to, have children with their significant others, they will get tested. But I'm really, really grateful to the BRCAStrong organization. You guys, I couldn't bring myself to join, like to look at your page every day until after I had my mastectomy, because before that I think I just was going head first into my surgery without thinking a lot, because I knew that's what I had to do. But now you guys are the best thing ever. And I'm really, really, really grateful. I've met some wonderful, wonderful people. And if you ever have anything to talk about, ladies, any questions, this is where you want to go. So thank you, guys. Thank you, Tracy. Thank you, Kate. Thank you, everybody.
Thank you guys all so much for being here. We have two other people to introduce on the call. One of them, Tracy, will be making a special announcement, so I'll let her introduce her. And the other is Gabby. Would you like to introduce yourself?
Sure. Hi, everybody. I'm Gabby. I'm Tammy's daughter. Hi, Mom. I wanted to come on here and be supportive.
If I had known it was going to take them this long to get you.
I just wanted to come on here and be supportive. I guess I don't know if I am or am not BRCA positive. When the time comes, I will be tested. It's a possibility. I know no one ever hopes for it, but I know that if I do have it, I have this great community waiting for me to hold my hand. So, hi, I'm Gabby.
Thank you for being here, Gabby. And all of us know how important it is to have our families and our friends support through this process and this sisterhood. So we're really excited to get into the program this evening. I'm going to go ahead and introduce our wonderful panelists. I'd like to remind everybody that's not speaking to please keep yourself on mute so that we can avoid any background noise. And we're going to go ahead and get started. So thank you guys for your patience and for being here.
Before we get started, I just want to go ahead and do a special announcement, and then Tammy's going to take back over. Just really quick and short, and then I'm going to get into my story. I would like to take this opportunity to say that BRCAStrong has grown so much over the past 5 years. I have dedicated my life, my time, my all. And tonight I'm honored to say that we have Dr. Alexia Gaffney, who will be joining BRCAStrong as the medical director. So I just wanted to take a second and introduce that. I know Dr. Alexia is popping on tonight. She has a busy life. We're super grateful for her. I'd like to just give her a couple minutes before we get started on the program, just to introduce herself. And then you guys are hear all about it tomorrow on social media, because it's something we're so excited and have been waiting for this day in a partnership. And it was just meant to be. She's been such an inspiration to me personally on her own journey, and not even as just a physician, just being her normal self and living day to day. So welcome, Dr. Alexia.
Thank you, Tracy, and thank you so much to the BRCAStrong community. I am Dr. Alexia. I'm a triple board certified infectious disease physician. I'm boarded and trained in internal medicine, general pediatrics, and adult infectious diseases. I'm a mom, and I am a breast cancer survivor thriver. So at 37, I was diagnosed with bilateral breast cancer. I often don't lead with that, but I did have cancer in both my breasts. I underwent a bilateral mastectomy as a result of a diagnosis of stage 3 right breast cancer, and opted to have bilateral mastectomies prior to knowing my genetic status. And it turned out there was a small area of cancer on the left as well. In spite of previously asking for both a prophylactic bilateral mastectomy, as well as asking for genetic testing and being denied, once I was diagnosed with the bilateral breast cancer, it became the story of, well, you're too young to have breast cancer and you have it on both sides, you need genetic testing. And I am a PALB2 mutant. and I have an ATM gene variant of undetermined clinical significance. So PALB2 mutation behaves very much like a BRCA2 mutation. I have not yet had my ovaries or tubes removed. And in spite of knowing the risk, I'm just really struggling with having to go back into the OR and dealing with the complications of the estrogen loss, excuse me. I had chemo-induced cardiomyopathy, and estrogen is protective to the heart. So I'm a little challenged by the idea of losing the little bit I have in spite of hormone suppression therapy, because my cancer was estrogen and progesterone receptor positive, HER2 negative. But being positive for breast cancer at such a young age, when I was diagnosed in 2018, I really could not find Black women in the community. I did not find much representation. And then I saw so much misinformation and disinformation that I started sharing my experience in real time, and then being invited into communities like this to share my story. And so I'm so grateful to Tracy to just allow me into this beautiful community that she has built. I'm grateful for everybody on this call who is a contribution to the community and to the lives of countless women, and always grateful for the time and space to share my story. I'm grateful to be able to advocate for women, to educate women so that they are empowered to get the care that they need. And I'm so excited about all that will come from this collaboration. I'm grateful to the speakers tonight and others that have joined this community to just really educate and empower women, to teach us how to advocate for ourselves and get the services that we need. So thank you guys so much for welcoming me aboard.
Thank you, Dr. Alexia.
We're so excited to have you as a medical director and help us with our content and make sure we're providing the right resources and tools for this wonderful community. So thank you so much. I'm going to go ahead and get ready to introduce our panel so that we can get them started. I know a lot of you have heard her name and seen her on a lot of the calls. You've connected with her through social media and through our Facebook Lives. Tracy Milgram-Posner is the founder of BRCAStrong, and she started this organization in 2015, or Tracy in 2015, after fighting alone for over 10 years against her BRCA genetic mutation, underwent 2 separate benign lumpectomies at 18 and 19 years old before being officially told she carried the BRCA2 mutation in 2004 at 21 years old. When her doctors informed her in 2015 that she had an 85% risk of developing breast cancer and a 30% chance of developing ovarian cancer, Tracy underwent robotic total hysterectomy, and 6 months later, she had a prophylactic double mastectomy. As she dealt with the physical and emotional effects of these aggressive procedures, Tracy saw the need for an inclusive community that would allow her and others to connect, share tips and stories, and offer advice on everything from post-surgery dating to clinical side effects and mental health. Tracy aims to inspire others by sharing her journey and encouraging others to do the same. And as you can tell, that's what all of us are here doing tonight. We also have 2 other wonderful panelists, Aly Rae, who you see here. She's a model, entrepreneur, author, and breast cancer purveyor. When she was 20 years old, she underwent a prophylactic double mastectomy in order to eliminate her risk of breast cancer. After 3 major surgeries in just 2 years, she went septic and almost died due to complications in a previous surgery. She ended up with 1 breast and was immediately dropped from all of her agencies. She was told she would never shoot swimwear and no longer sexy to men. Aly Rae was persistent and wanted to show women everywhere that regardless of what society deemed as sexy, you are beautiful. Went on to be the first woman in Glamour UK and Vanity Fair UK with 1 breast in a swimsuit. She now has 2 breasts again, but continues to show women everywhere that you can be beautiful no matter what your body type is, regardless of your breast scars and anything else that society deems normal. Aly Rae has written 2 journals that help women battling breast cancer and BRCA to communicate their feelings, and also helps to run a nonprofit called Save the Women, where people in the community photograph survivors to help them feel beautiful and sexy. She also owns a cosmetic company and is currently attending Grand Canyon University to be a psychologist. Her ultimate goal in life is to advocate for loving your body and choosing life over what society has deemed normal. And of course, our famous and well-loved Dr. Christopher Trahan is part of our world-renowned team pioneering revolutionary breast reconstruction techniques at St. Charles Surgical Hospital and Center for Restorative Breast Surgery. Dr. Trahan graduated cum laude from Louisiana State University in Baton Rouge and received his medical degree from LSU Medical School in New Orleans. He served his internship in general surgery and completed a residency in, I don't know how to say this word correctly, otolaryngology.
Close enough.
There you go. Head and neck surgery, both at LSU Health Science Center, followed by a plastic and reconstructive surgery fellowship at the University of Nebraska Medical Center. Dr. Trahan specializes in breast reconstruction and clinical interests in cosmetic surgery of the breast and body. He is a member of the American Medical Association and is board certified in plastic and reconstructive surgery. And for those of you that don't know, it's really important that they're all board certified. So we're happy that he's here with us tonight. He's received many honors and is here to share his story with us. Thank you guys. Thank you all for being here on our panel this evening.
So
Thank you all for having us.
good evening. For those of you that don't know me, obviously I'm Tracy Posner, the founder of BRCAStrong. Normally I start with our mission, our vision, and tonight we're lucky to have our secretary, Tammy, run the program for us. So as Tammy stated, I, at the age of 18, had my first lumpectomy, and at 19, my second one. At the age of 21, I found out I carried the BRCA mutation. From there, I went ahead, I had children, just what I wanted to do, and underwent surveillance for over 10 years. At the age of 32, after bearing 2 healthy children, I decided it was time to be proactive. I underwent, as Tammy said, a robotic hysterectomy with a prophylactic bilateral mastectomy 6 months later. But going through my journey and why tonight is so close and near and dear to my heart is loving yourself is loving your health, and knowing your options and what are out there. I have faced many different barriers, and I want to avoid these barriers for women in our community, as I unfortunately have had 4 revisions. They've all gone wrong. Most recently, I will share that I have undergone an implant removal of my right side due to excrusion and pec muscle issues. Thankful that last year in July, I learned from Dr. Trahan, and why I have him back on tonight is what it really meant for your pec muscle to go up and the excrusion of your skin. And I never knew any of these options. And I was just basically being told, you know, your implant's there, it's not, and you know, it's there and you don't have to worry. And after speaking with him, after having scans done, you know, I went for an ultrasound and they found out that my implant was—
Can't hear you.
They found out that my implant was 2 millimeters from my skin. And I reached out to Dr. Trahan after seeking, you know, different medical options, and basically told him what I was facing. I sent him my records. I sent all of my information saying, what are my options? I saw several different physicians in Miami, and I have been told that I'm a candidate only for a unilateral, not a bilateral. I have— obviously, as all of us know, it's traumatizing to go through a mastectomy and lose the body part of our own and live every day as a woman. And I've felt that our community needs to know more education, because going through these procedures mentally and physically, going septic like Aly, having different complications, and now just walking around with one implant is really just not okay for any woman to have to face, nor are the barriers in our insurance. Every woman has a different journey. Some of us are blessed to have a very easy journey. Some of us have complications. And tonight I want to make sure that all of our options are on the table. And I was blessed to know that and come through my journey. Knowledge is power, knowing your options, early detection saves lives. And most important, I will say there is no gold standard for us women who go through mastectomies and standard of care. You see 5 different physicians that all say they do DIEP or do flaps, but they all do them different, or they don't have the gold standard. There's a BMI, or there's blood vessels that aren't correct. And I know these are all things that Dr. Trahan's going to speak on tonight, but really, I want to just be here today to let you know I am an advocate for all of us, regardless of our situations. We need to stand up. Our voices need to be heard. Insurances should not mandate where we go. We are a woman and should never have to lose our womanhood through any struggle, no matter what you face. And I know that there's a lot of us out there that feel what I'm going through or in different ways. And I'm thankful for everybody. So I would like to now pass it over to Aly.
We love you, Tracy.
Thank you.
Hi, I'm Aly Rae. When I was 20 years old, I had a double mastectomy because my mom had breast cancer and she was BRCA positive. And my father passed away from brain cancer when I was about 13. So I, at 18, knew that I wanted to have a double mastectomy to protect myself and my family and keep cancer out of my life. I was a kid. I was 18 when I found out. I got married at 19, so I waited for my husband to get back from deployment before I had my surgery. And I went into it very blind. My mom had cancer and was going through it herself, but I had no idea what my options were. My husband and I kind of just got thrown into it. And after 3 surgeries in 2 weeks, I went septic. I was in the ICU. I almost died. And I had one breast for about 1.5 years. So that was not a fun journey for me. My doctors were not helpful. They were not nice to me. They weren't kind to me. After my 3rd surgery and being in ICU, my doctor, when they were getting ready to let me out, my husband was like, you need to give her more medication because we didn't expect a surgery to go this long. And he told me I was a baby and that while my surgery was a surgery, he was very gentle and I should be fine. So that was my experience. And then I went on to lose my entire career. I've been modeling since I was 14 years old. They told me I wasn't sexy anymore and nobody wanted me, and that was it. So at 20 years old, my whole life felt like it was just shut. So I've spent my entire life trying to teach women that it's all about loving yourself and finding, what makes you feel great. I was the first woman in Vanity Fair and Glamour with one breast. I'm so happy to say that since then, this month, they put a woman on the cover of Glamour when she had a double mastectomy, completely bare, everything. And that was the most incredible thing I've ever seen in my entire life. So that was fantastic. But basically, my whole thing is about loving yourself and getting out of the depression of feeling different. I couldn't walk through a store without feeling like people were staring at me and knew that I was different, and that's not the case. So that's my whole thing. If you guys ever need help or just want to talk, you can reach out to me on my Instagram or anything. I'm always willing to talk and try and make you feel better about, what you're going through and giving my opinion, I guess. But that's pretty much it, right, Tracy?
I really appreciate it. And, one thing that I want to say is obviously we're all part of, different groups, but finding the ones who inspire you and give you that inspiration to push through. I know when I first had my emergency surgery, like I had just met Aly and just the contact that she made or I made with her, like she was always available to answer the questions, and knowing, I'm going to throw her hashtag out there as one boob badass, there's those people that, we wake up and when we look at social media, we see people who are draining us. Let's not look for the people that are draining us. Let's look for the people that are inspiring us. It takes everybody's on a different level, but I certainly know, like on my super bad days, I look at Aly's page and I'm like, I got this, and she talked about like being Wonder Woman and, just feeling and actually loving yourself. And I appreciate you sharing your story and being so open and just explaining to women that it wasn't easy, and what you faced of going in and being told you can't model and still getting out there and being that one boob badass really just makes you one powerful badass. And I really appreciate everything that you do for our community. And what I would like to say is let's have Dr. Trahan come on, and maybe before he starts going over some of his other stuff, maybe Dr. Trahan, you can relate a little bit to like what women go through when you see and come through us, we're always talking about, to love yourself is to love your health. And obviously all women don't have the availability or know about your center or you and your options. What are some of the things that maybe you can touch base on with like loving yourself and loving your health and knowing your options? But welcome back. Thank you again.
Oh, thanks for having me. And nice to be on with somebody like Aly Rae, who's a very inspiring story, as is everyone's. And it's so nice to see such friendly, familiar faces that all the wonderful, beautiful women that I've taken care of, and just your feedback and just your presence inspires us to continue to push forward with the missions that we have. And I'm a surgeon, and my job every day is to do surgery, but the why of what I do has become more evident every year, the 15 years that I've been doing this. And one of the biggest things that I can recall, and just to give you context from a human perspective, of what I was witnessing as I gained more experience, and because when I completed all my training, I approached things as a technical exercise, a problem to be solved. Measurements and three-dimensional visualizations, and going through it. And when I started when we started the center, when I started there in 2006, 2007, there wasn't a whole lot of people doing autologous work to the level that was completely muscle sparing and had the goal of restoring complete beauty. The figuring out the why came as I grew emotional intelligence with listening to all of my patients. And here I was seeing women who were 5 years, 6 years out from their diagnosis of breast cancer, had overcome the thing that tried to kill them, but they were still stuck where they were in terms of trying to overcome and get through it and on with their life. And it was just it's become one of the most eye-opening things to me, because over half of what I do is corrective surgery. And some of the things that I see never cease to either amaze me or flat out upset me, because I see people that I relate to, human beings that I look at everything that they've been through. When I see multiple surgeries over a number of years, and the reality of it is that, was it avoidable? And the answer is absolutely. And there's just there's a lot of reasons why this is one of the biggest unspoken women's health issues going on right now completely, because not only does it cover access to information, access to care, but there are significant access to care issues with insurance issues, in terms of the amount, the knowledge base and what's offered to people. There was a famous study done in 2007, 2008, American Board of Plastic Surgery, in terms of and women who are facing mastectomy, whether genetic predisposition, preventative mastectomy, or diagnosis of breast cancer, how many people knew their options, like the full gamut of what the options are. And the results were quite horrifically bad, and an indictment on not only us as a specialty, but it was kind of a call to arms for a lot of women who were fighting this journey seemingly alone, or when at the time of diagnosis you become least equipped to be able to make a complex decision or even advocate for yourself. You know, and it's clear as mud at this point. It still is. And so that study found that 7 out of 10 women had no clue what their reconstructive options were. And even if they were discussed about, they were told they weren't candidates for this or that, or, you know, they were only limited to one option. And as disturbing, if not more, in that study was that, you know, that 7 out of 10 was the whole number of women that they polled, a lot of women who were over 1,000, and those numbers were even worse for women of color. And you wrap all that up, and you have us, our specialty, as well as you know, the oncology arena. And we've done a very, very poor job of uncoupling the notion that this is all about vanity. And it has been quite amazing. And I share this story a lot because there's always an aha moment when you finally, when the light just turns on. And I was lucky enough to have it happen early in my career. And it really just and it was a really, really gut-wrenching experience I had in seeing a patient for a consult that was 74 years old. She had been diagnosed with breast cancer and was a recent widow. My patients who are on here probably heard this, but it was such a profound story, had a profound effect on me in terms of what the why am I doing this? And why are we pushing for it? Because there's a lot, the learning curve to do these autologous reconstructions at a very high level is the learning curve is brutal. So what's keeping us pushing? What's having us push the envelope, continue to innovate and develop? And this lady was 74. She was a recent widow. She had 2 daughters that lived out of town, was very active and independent in her community. And she just said, well, just take it off. I have nobody to show. I live alone. And that happened. And she was referred to me by a psychiatrist and a psychologist who had seen her, who had diagnosed her with PTSD. And she had removed every single reflective surface from her house. Anything that she could see a reflection, she wanted out of her house. And I remember her sitting across from me, crying, just saying, it shouldn't matter. It should not matter. I don't know why it matters. I can't figure it out, but I can't articulate it. And I cannot even look at myself. And I was just sat back and I was like, wow, this is what it's about. And I had a little bit of, I struggled a lot after that because I have a mom who suffered in silence for years. And I just kept thinking how hard it was for her, but she had nobody to talk to. And she never knew, and she kept it to herself. And when I talked to her about it, I mean, she lost it. And it was a very cathartic moment for both of us. And at that moment, it was when I had a new lens for this whole issue. And I will say this, I used to be very diplomatic about some of this stuff. And it's hard now to be diplomatic because there's at a time where you can usually look up anything at your fingertips, you know, it's still clear as mud because, you know, at the point where you're having these questions about what your options are, that there's, you know, implant reconstruction is the most common form of reconstruction in the United States, no question. Why? It's because it's the easiest. And it's and it doesn't mean that there aren't good implant candidates. There are a lot of other issues that have to supersede that. But if I'm somebody who dabbles in autologous surgery, like I don't do a lot of it, it's a very stressful operation. And so people tend to get steered in ways that aren't really accurate, meaning, oh, you're too big, you're too this, or you're too that, or your vessels are this, or your vessels are that. It's a way to kind of steer you into what people do, because nobody wants to lose patients. And but the problem is the stakes are much higher, because the goal of restoration is part of the treatment of breast cancer. And when you have the goal of any treatment should be to get you through it and on with your life, and in a way that's you don't have to sacrifice who you are. And if you have that option and you know about that option, then it makes a lot of sense. And please stop me if I'm rambling. I can talk about this for days, but there's a lot of very very important aspects of this that need to be covered. And I think it's important to have women who've gone through that, because I see a lot of people on the front end of their journey, people who are recently diagnosed and just shell-shocked and like, what the hell is going on? And I see people at the end. And if I just had to see people at the beginning at that phase, it would be gut-wrenching. But since I have a ton of experience and have seen people go through the journey and to where they can be, it's really something really special when they're complete and they're done and they feel whole, because all other aspects of their life seem to fall into place after that. Again, women are told some horrific things. Oh, you should just be happy you don't have cancer. You look good in a bra. You look good in clothes. But what I've learned and what I've seen is I've seen countless patients come through and tell their story, and it's just having a mastectomy to a woman is an amputation, and until it's treated as such, the dogma is and what I mean by dogma is why do we do it this way? Well, it's the way we've always done it. And there's a ton of that in this specialty. Okay. Anything from techniques of mastectomy to techniques of reconstruction. And I see things that are done, mastectomy incisions that are made, that have no real place in the specialty right now. It's just, oh, well, it was the easiest exposure. And go ahead.
So I know we have, like, looking at our community out there tonight, we think we have women that are just starting their journey, women that are facing complications or just in the middle of their journey, and then women that are at the end of their journey. If you guys don't mind, just so we make sure we obviously give you all the knowledge that we can, is there anybody who is just beginning their journey and looking into breast reconstruction options? If you want to. So if you guys don't mind, just so we can make sure that we answer your questions as well, because I know Dr. Trahan could tell us a lot of information, and I want to make sure that you guys get all the knowledge out of it that you can. Melissa, maybe if you want to unmute yourself, I'm not sure, are you familiar with the DIEP? Are you looking into implants? Like, what if you could ask a question, right? What would your question be?
Okay. Sorry for my screaming toddler in the background.
It's okay. Don't worry. We have those.
My mom had the DIEP reconstruction at NOLA, and I was actually, she just called me and and I told her Dr. Trahan was on. She's like, oh, she's like, he did one of my surgeries. I'm like, oh, okay. So, so I know very little about it other than her recovery, and her recovery, you know, from NOLA was obviously incredible, but they were there to fix a job that wasn't done right the first time. And so that's, you know, my big concern. And my other concern is that I have autoimmune issues, and implants are definitely not on my radar. That is not something that I am interested in. So I've had 4 abdominal surgeries, 2 C-sections, and 2 laparoscopic surgeries. So, you know, I have a concern as to whether or not I'm a candidate. And so like, I'm just truly starting down this road, but implants are not on my radar at all. So I don't know what like my options are completely.
Okay, hold on one second. And let's see if Jamie has a similar question. So I figure if we can make sure that we're touching bases on all the aspects. So Jamie, do you have any certain questions like regarding DIT or?
Not specifically. I'm kind of looking into all my options, and I'm meeting with my surgeon next week. But frankly, like all the horror stories I've heard, and Dr. Trahan's kind of reiterating that not all doctors know what they're doing, or not all doctors are going to honor your wishes. And that concerns me, because I'm hearing that I'm really going to have to advocate for myself. And so I appreciate you sharing that, Dr. Trahan, because I don't want to end up with multiple surgeries. So in exploring my options, really learning that I have to advocate for myself.
Perfect.
Yeah, those are, you know, Melissa, you hit on a number of really, really important topics, and I can tell that you've been listening, and probably in some online groups, and sharing and listening to other people's experiences. So to answer the first question, I agree. If you have any autoimmune concerns, you should not involve with implants. I will just tell you that in the hundreds of, there are thousands of implants that I removed and replaced with tissue. I can tell you that there is something there to breast implant illness. I don't think it's something that's kind of one of those unspoken things that is almost taboo within our specialty, but there's something there, and there's been some direct evidence that I've seen, and more so in others. I'm not saying it's a bad option for everybody, but I wholeheartedly agree that there are some people who have issues, and inflammatory issues. They can be local inflammatory issues or systemic. I've seen it both ways. But so I agree. And the answer to your other question, having multiple surgeries, I would say 80% of our patients have had prior abdominal surgeries, whether it's laparoscopic surgery. Most common would be probably C-section or hysterectomy, but C-sections, laparoscopic surgery, that does not exclude you as a candidate at all. In fact, it really doesn't affect it. You know, from a C-section, even though they use a low transverse incision, they go between the muscles. They may have to cut sometimes if it's an emergency C-section, may have to cut a little bit more. But typically, no matter what manifests from that, there are ways, there are techniques to work around them, and they certainly don't exclude you as a candidate at all. And you know, and your other question dealt with. Can you repeat your other question? I'm sorry.
I think that was it, question-wise. I just
Okay.
basically what my options are, because I only know what my mom had gone through. My mom had come to you with spacers, you know, anticipating getting implants. My mom's last name is Veet, by the way, but you actually you did a surgery of hers when she came back down because she had a small infection. But you know, I saw what she went through at her, you know, for her first surgery, and like all the like gaps that she had on the side, and then how she really struggled with that, and how she struggles with the you know, the loss of sensation and all those things. I'm not a great surgical candidate to begin with, so it all just makes me really nervous. But at the same time, while my sister's currently going through, you know, treatment for ovarian or primary peritoneal, like I can't, you know, I can't ignore it. The
Right.
the gene is strong. And you know, I actually went through IVF, and what was interesting is that every single one of my embryos, there were 13 of them, every single one of them was BRCA positive. So, you know, 50-50 is not truly 50-50 in everybody's world.
Right. And I think your concerns are valid. I mean, look, at the end of the day, these are surgeries nobody would choose to have unless you actually faced with some real tough decisions, right? So, and I'll start at the, let me just start at where if I look at all the patients that I've had to correct over the years, when I look back on where did all that start, it starts with the mastectomy. Okay, it starts with the mastectomy quality. Now, what do I mean by mastectomy quality? There's no standard to quality. Okay, and what I mean by that is the difference between a perfect mastectomy, meaning complete tissue eradication and preservation of the skin. The difference between a perfect mastectomy and a disaster mastectomy, which usually means skin loss or skin compromise, to where if you have an implant, you may lose the implant or expose the implant. The difference between a perfect mastectomy and a disaster mastectomy is millimeters. Okay. And it takes a learning curve, it takes experience, and it takes time and finesse. And I've worked with a lot of breast surgeons in my career, and the differences in quality have been fairly significant until we've kind of discovered, you know, what and who would create a mastectomy or was committed to performing a mastectomy, taking the time to perform a mastectomy that was pristine. Okay. And so things start with the quality of the mastectomy. I would say if the things that would be a red flag to me from a surgeon who does mastectomies is, well, I've been doing it the same way for a long time, or I only use one incision, or, you know, even somebody who says, no, you don't even need to have reconstruction, or you shouldn't have reconstruction. That in particular has been disproven time and time again, where the question of does reconstruction hide things, or does reconstruction cause people to get delay in diagnosis? And then the answer over years and years of data is no. And again, that's part of what dogma is. And it's hard because there are plenty of people who do it, and it's hard to figure out who does what. And, you know, I think one of the things that, you know, that I see a lot of is expander usage. Expander usage is something that was started, you know, probably late 90s, early 2000s, when people, you know, and the whole reason for expansion is that a mastectomy is extremely stressful on the skin envelope. Even in the most perfect situation, it is stressful. So the concept of expansion is you don't want to stress the skin envelope from the inside out right after a mastectomy because you're afraid the skin's going to die. Well, it's slowly inflated over time, but the whole reason for expanders is because people don't have confidence that the skin's going to survive. And it's kind of a, having seen pristine mastectomies that don't require expanders, I know that it's possible to not need to have expanders. You can either go direct to implant if implant is your choice, or you can still have an intact, healthy skin envelope after a mastectomy and have all your breast tissue removed. And and that's the gold standard. And I think things are probably slowly evolving there, but certainly not fast enough. And the most important thing for everyone in this group who's encountering or facing it is to know that matters, and know that not all mastectomies are the same, just like not all DIEPs are the same. Everything's different, and there's so many nuances and so many variables to consider that it literally can consume anyone who's trying to find the right information to do it, and decide something that gives them peace to move forward with it. It's a huge decision, and the system's almost stacked against you, right? So you go to these big hospital systems, and they want your imaging, your biopsies, your treatment, your surgery, all done at one place. And the results aren't interchangeable. And it's and so it all starts with a mastectomy. Using your own tissue, comes in different flavors too, right? So one of the big debates in our specialty is and one of the accepted practices within our specialty when you do something like a DIEP is, can you take muscle? Well, the consensus on most academic panels is yes, you can take muscle as long as it's not a lot, or less than 30% of the complete width of the rectus muscle, which to me is an awful lot. And so muscle preservation is a big controversy within our specialty. So there are DIEPs, like if somebody says you do a DIEP, well, do you take muscle? If they say you take muscle, then they're honestly, from a technical standpoint, they aren't doing a DIEP. They're doing some version of a muscle sparing tram, which that's kind of an oxymoron, but transecting the rectus muscle. And just let's talk importance of that. The importance of the rectus muscle, most people think they're two big muscles that line your abdomen, and they allow you to do sit-ups or have a six-pack or flex your trunk. The main job of those muscles is to counter your back. Okay, so you can take muscle and you may be able to do a sit-up in a year or two, but when I see patients that need correction, I'm not seeing them at 1 and 2 years. I'm seeing them at 4 and 5 years. Okay, and their abdomen's erect, not because a little piece of muscle was taken out, but what comes with that piece of muscle that's transected is denervation. Okay. And denervation is almost worse than a hernia, because at least a hernia has a boundary to it. It just keeps going and going. And people have I've had some patients come in who've had DIEPs and looked like an alien coming out of their abdomen. And so it's just mastectomy quality matters, DIEP quality matters. And it's unfortunately, self-advocacy, you're trying to do this journey through a headwind, and so I don't envy anybody in this situation. And my whole thing with especially seeing my former patients, or they're never going to be my foreign patients. They'll always be my patients. But it's the when you're on this side of it, or you get to where you're on the downhill of the journey, or at least you see that it is reaching women who have just been diagnosed and have no clue where to turn. It's at that moment that the biggest differences can be made. Because, and look, I don't care if I don't care what people end up doing. It's making an informed decision in somebody that has your interests in mind, and not only your interest for next month, but interest for the rest of your life, and interest in you not only getting over the disease, but getting you back to having a plan for that basically fixes the amputation. And I would say that the advances that have been made in breast cancer diagnosis and treatment have been phenomenal. You get your pathology result, and you get specific data on what your recurrence rates are and what your narrow lanes of treatment. Reconstruction is the Wild West, okay? Because there's no standard. And I can go to a conference and sit and watch, and people throw up results that I think look fairly bad, and that's just become acceptable. It looks okay, or that's the best we can do, and so the bottom line is that there's a lot of misinformation, and the answer, if you have to say, well, I've been told I wasn't a candidate, that's not true. Tracy being a prime example. And it's not true. And it's more reflective of someone's comfort level in doing it. And that's fine if you're upfront about it. Okay. It's just, go ahead.
So Dr. Trahan, we have a couple of questions coming in, and I want to make sure that they get the opportunity to get those to you. A young lady had sent in a question. This is week 7 after phase 2, and she learned some time ago that significant extensions of scars, it's like a ligament, can't be released. However, people with scars that are 20 and 30 years old can still release, and it helps significantly in the healing process. From what I feel, would it be possible, what does this say? Why is the flap on the R side, the cancer side, did not stay in place this is difficult to read, I'm sorry. I think this is, where is she? Naidu, do you wanna ask this? Okay. You're on mute.
Okay, I'm sorry about that. Yeah, my question was that as a myofascial release therapist, Dr. Trahan, it's, hello, Dr. Trahan.
Hey, how are you?
Good, thank you. So, that I treat the fascia system. So I had been searching why, my issue with the right side. I don't know if it's that the procedure that you explained me about the flap, and there is a small difference between the left and the right. So when I get treated with the myofascial release therapist, and when I treat myself, I found, and I completely forgot to tell you that before the second phase, I found very restricted through my own right side. And actually I'm in pain right now. It goes through my, through the breast. It's kind of a mirror. It is on the back and the front of the breast. So my question is is that possible that the restriction or the scar tissue, it is so big or huge, or the amount of the scar tissue that I have, and probably more into the right side, it's so hard as that ligament that I said, hard to break, and the possibility that the pulling of the force of that pulling into affecting the results of the second phase.
Mm-hmm. So your question is centering about scar tissue that forms after surgery that could limit or cause pain, and what the options are for that. Is that the
if it will be maybe the possibility, the pulling of the fascia restriction, or the pulling of the fascia restriction caused by trauma or caused by scar tissue, not necessarily has to be related with the trauma, or the issue with the surgery itself, but there is a force that's creating the pulling and more into the right side. So it may be the scar tissue is creating that pulling, and it's hard to break. I'm working on that. I'm working on the scar tissue. I'm working on the stretching. It is painful, and I feel like I had been pulling then. So I don't know if that caused that. Maybe it's a possibility that the scar tissue caused that the fold or the pulling down.
Well, scar tissue is kind of a broad term, right? There's a lot of other issues that happen after mastectomy. Okay. When you have the breast, the nerves to the breast skin come through the breast tissue, those get removed. Okay. So after a mastectomy, if you can imagine a very large raw surface area of tissue that has the natural boundaries that have basically been blown through to get breast tissue, right? Inframammary fold, lateral breast boundary. Now, you have the issue with scar tissue formation that can entrap some of the small nerves that are cutaneous nerves that go to the skin that can cause. And the other aspect is, after a mastectomy, you do get some gradual sensory recovery. Okay. Now, the first receptors to recover from surgery are the sensory receptors that sense pressure and stretch. Okay. And for lack of a better explanation, the volume on them is turned way up. Okay. And being a physical therapist, the dysregulation that can happen with the absence of nerve input, that, it's all related. So you have absence of nerve input, and you have this rewiring kind of going on, and you have nerves that are very sensitive, and there is different people have different susceptibilities to nerve type pain. And if you have neuropathic or nerve pain, it can create reflex spasm in not only the pec, but the entire chest wall. In my experience, I've never seen it not go away in some capacity or get tremendously improved. It's never on the schedule that we want, I can tell you that. But you're someone who's very in tune to your body. You have an awful lot of knowledge in terms of myofascial release and the musculoskeletal components to this recovery. And so feeling pulling can either be tethering by scar or nerve entrapment that's creating a reflex spasm during certain movements. Okay. One of the things that can create tethering is, and this is variable in different people, is, and I mentioned it a little bit before, but the inframammary fold ligament. Okay. The inframammary fold ligament is often affected adversely by mastectomy because it's a natural bore of the breast. And that's one of the most difficult landmarks to reconstitute. And most of the reconstitution techniques involve retethering that skin and soft tissue in the inframammary fold location to the chest. So when you have a dynamic going on where you've had surgery on your tummy with a downward force and the upward force of the inframammary fold support, you have some internal tug of war going on, okay? And that, it does abate. It does take a little bit of time. It is, I can understand it being very frustrating. If the pain persists despite improvement in range of motion or soft tissue feel, pliability, and movement, then there may be an issue such as something like a neuroma, which is basically a scarred nerve ending. So when the breast tissue is taken off of the chest wall, the nerves that go through the breast tissue to the breast skin and everywhere else are basically cut off like tree trunks, right? So when you have skin that heals back down to that in certain areas where it's basically just skin on a scarred nerve ending, that can be very focally painful and create restrictions in range of motion. There are certain people who are more susceptible to them, but the thing about a neuroma is that it's easy to cure because you can localize it, you can find it, and you can excise it. So there's a lot of stuff still going on in terms of your sensory recovery, your musculoskeletal recovery, and but you're in tune with it.
Yeah, well, I'm sorry.
Go ahead.
I was talking to my colleague that it is amazing the work that you do, you know, in terms of sculpting. It's an art, and it's a sculpt, you know, the body. And to do that, you really need to know to do it, and it's beautiful, the work that. Even though I am one of the most recent, I mean, my surgery was December, so I'm still recovering, but I can see the changes though. Still in pain, still recovering. The skin, as you saw, it is better, and it's amazing. And it's amazing for me just the fact that I have been treating clients who have a double mastectomy, and they have been saying, no, I cannot have any breast because they cannot find, I mean, they decide to not have it, but I know they're going through a lot of emotional and psychological. And even though when I woke up then and I don't have to see, I mean, I found myself then with breast, that is already amazing, and I'm grateful for that. The inside of us, and you mentioned also the emotional, and this goes with everyone then, but the emotional intelligence then, and I have been through the years then to experience that the key for healing is to feel it. So and you're holistic, and my husband, the first time we saw you on the Zoom meeting, he said he's holistic, because we had been with other doctors that I didn't feel for it. It wasn't an option for me. As I said, I treat clients with implants then, and I have issues on their backs. And so this is still amazing for me and for my friends who have been seeing me before and after. And it's still a journey, of course. But I think that the key for all of us, but I do applaud that you went into the emotional intelligence and to feeling and to being with us, because that is not, I will say you are the doctor and the group of doctors who really are with us in the physical and the emotional journey.
I appreciate you sharing. I'm sorry.
Thank
I
you.
just want to give some other ladies the opportunity to share, because I know some of them have little children to
Sorry, no, just go ahead. I'm sorry.
Thank you so much. No problem. Anytime, you could feel free to always ask questions to us, and feel free to email us and join us on our private groups. I know Mary has a question, and then
I'd kind of like to close out, and I could stay a couple minutes behind just to talk to a couple women really quick. But I know Mary has a question, then I want to do a closeout, and my closeout's going to be, Dr. Trahan, you can think about it, and Aly, if you could give one or a couple words of advice in like 20 seconds, what would it be? But Mary, go ahead first, and you can ask your question, then I'll go, and then I'll have everybody else go. So Mary is amazing. Just so you guys know, she's the one who actually does all of our masks and is helping us create a lot of stuff behind the scenes. We really don't talk about her, but she's been super dedicated and super awesome to helping us grow our nonprofit. And like she said, it's a sorority nobody wants to be a part of, but I've been blessed to meet a lot of beautiful, amazing women. And Mary happens to be one of my, all-time favorites.
So silly. Thank you, Tracy. But it's very related to Ms. Nadu was saying about that pain on a breast rather than both of them after a mastectomy, because I've had that excruciating pain in one and just that regular tingly pain on another. And I recently went to a 1-year visit to where my surgeon used to be, because unfortunately he passed away, which is more to the point of my question. And I told him about the pain because sometimes it takes my breath away. And when you were saying about that pain in the chest is very relatable to what happens to me. So would that be something that I had the question right there on the tip of my tongue, but would it be something that it'd be easier to ask the plastic surgeon rather than the breast surgeon when it comes to that pain, or if it's maybe a scan that they have to do in case of scar tissue or anything bad that may be happening after the mastectomy?
Right. There's a couple of different aspects of pain that need to be, and how would you describe the quality of the pain? Is it burning, shooting, deep,
it's
heavy?
Like a shooting pain, like a chest pain. Mm-hmm.
So shooting pain is typical of nerve regeneration. Okay. Nerve pain. I can tell you can bring it up to whichever doctor you want. And the question is it something that is either A, correctable with any other procedure, or B, will get better over time. And I tend to think people know their own bodies better than we could ever know them. So I think the best scan at times is our ears and listening to what you feel and what you describe and what you experience. Based on what you're discussing, it likely is either A, a neuroma, which is again a localized scarred nerve ending that, in the natural history of it, or the progression of neuromas after mastectomies, and the ones that I've seen, it starts out fairly constant, then it kind of switches to somewhat intermittent, and then you can do a motion somewhere. It can be the most mundane or non-involved motion, but it'll drop you to your knees at times.
Yes, that's what it had. That's what.
That's typical of neuroma, and that.
But it's like I usually get chest pains myself, and it feels like somebody's stabbing you, as per se. So it's really bad. And I asked him, and the weird thing that scares me is that he tells me I've never heard of that before. No. So it's like that kind of freaked me out. And like I said, he's not the surgeon that did my surgery. He's a replacement in the office that my surgeon was at. So he don't know my full scoop of what happened to my surgery. So sometimes I even think that I may have to change my doctor.
Well, I will tell you this. There's a very simple way to diagnose it. If you can basically take one or two fingers and point to the area that's hurting, all you have to do as a physician, and what I do is I'll inject it with a little numbing medicine. if it goes away completely, that's what it is.
Okay.
There's no other test, there's no other scan that you have to that you have to do. And you know, generally, if that's your diagnosis by injecting and you get complete relief, then you know it's something that if you remove surgically or release a scar where that nerve is tethered, that you could get relief. So
Okay.
Mary,
if
ask Flores. Flores does it. He did it to me. Flores, they'll do
Yeah.
it in his office. He'll do it right in his office.
Yeah, I haven't been to Dr. Flores yet.
But if you
the
call
fact
him,
that,
he'll do it right in his office.
and
yeah.
I'll also add this caveat, and that I've had some people who've had, you know, in their early recoveries, you know, a little bit of nerve pain here and there, and I don't, if I can help it, I don't like seeing people kind of white knuckle through it. So what I've seen is, like, if you inject with the shorter acting local anesthetics like lidocaine or even Marcaine, which is a little bit longer, that result is, you know, you get a tremendous relief and then it comes back. What I've found with this medication called Exparel, which is a long acting local anesthetic, like on the order of days, I've found interesting that when I inject the same type of things with Exparel, I think it shuts the nerve down for such a long time that it resets it. And so when an Exparel wears off, people are like, yeah, I may still feel it, but it's way better. So there are some other things that you can try. And I've discussed this with a few of my friends who are neurologists, and they're like, well, this is why it makes sense. But it's really interesting in practice, because I think it can make a real difference.
Perfect.
And
Thank you, Dr. Trahan.
All right.
Thank you so much.
So I'd like to take tonight and say thank you so much, Dr. Trahan, for coming on and educating us. Aly, thank you so much for your inspiration and sharing your story. What I would like to personally close out with is be your own advocate and know your breast reconstruction options. For those of you that don't know, next week we are relaunching, rebranding, reprogramming for 2021. One of our sponsors is actually Dr. Trahan and his group. We are super excited for the new program that we're rolling out. We will be able to fund several women and offer lots of products. And I'm going to just say that for right now. We definitely look forward to rolling it out and sharing all the information with everybody. So make sure you tune in next week. With that being said, again, thank you so much for your dedication and time, Dr. Trahan. The words of advice that I would like to leave everybody with tonight are know your options. And again, know your breast reconstruction options. I am fortunate to be an advocate for myself and have taken time. And yes, it has taken me 8 long months. I've battled with Dr. Trahan. I am not giving up. You be your own voice. If you're scared or you have hesitations or you need somebody inspiring or to be by your side, you can feel free to always reach out to myself, Kate, or Tammy. I know as Aly's been a huge inspiration to me. If anybody's going through losing a breast or feeling less of a woman, I want you guys to all make sure that you reach out to us, as we're a sorority, to support each other and just lean on each other. So Aly, if you don't mind, I know you and I have spoken on several different occasions, and, you know, loving yourself is something you really focus on, and you know the struggle that you've been through, and maybe just a couple words of wisdom to pass on to just some of the women that are on the call and that listen to this video.
So I had mentioned earlier that my mom was also a breast cancer survivor, and I really struggled with not having anyone to talk to because I didn't want to tell my mom that I felt ugly and gross and those words, you know. And so I kept it to myself, and it really pushed me down. But the biggest thing that I learned was that if you couldn't say it to someone you love, do not say it to yourself. Because as I was saying those things about myself, I could never say those things about my mom. And it made me realize how nobody really just thinks of it that way. And once I did that, I really got to change who I was. And people were mean to me and said horrible things to me when I first started modeling and putting on a bathing suit. Nobody wanted to see someone who looked like me or everything like that. But once I really started to love myself, other people did as well. So I always say, if you can't say it to someone else, do not say it to you. You need to be your own best friend. And that's my biggest advice.
Thank you, Aly. Dr. Trahan, if you could give all of us ladies 2 words of wisdom or a couple words of wisdom, you know, from a physician side and from who you've had family members and affected, you know, what would they be?
Well, first thing is that you guys need to realize as a group the power that you all have. Okay, y'all are way more powerful and able to reach people who really need it in their time of ultimate loneliness, because everybody who's been through this has described the loneliness that they feel when they're diagnosed. So understand the power that you have and the people that you can really affect by just getting them to take a deep breath and think through it. But the biggest advice, and you say it, and it sounds like cliche, but you have to ask tough questions. The days of some person in a white coat wagging their finger at you, telling you you need to do this, that's done. Okay, y'all have understood that this is a women's health issue, and you know that this is delivered in a way that is kind of almost a factory approach. That's what I would describe. That's why we have results that are all over the place and no standard, because it's almost a factory and impersonal approach. And we as a specialty have failed to understand the true meaning of what it means to be whole. Okay, this is not a vanity, this is not cosmetic, but ask the tough questions. How many of these do you do? What are your thoughts on mastectomy approaches? Okay, do you spare, or am I candidate for nipple sparing? And if there's a one size fits all approach, that's a red flag. Okay, and if, oh, you'll probably look good, we just want you to fill a bra, or just you can hear. If you listen, you'll hear. And just, I guess there are questions that have to be asked. If you're not a candidate for, if they tell you you're not a candidate for reconstruction, ask them why specifically. And there's a lot of things that can be that are propagated as dogma that aren't reality. I can't tell you how many people, I'll end it with this, and this should say enough. The most common thing that I hear in my office, in my consult room, is, I wish I would have known.
So let's take that, I would have known, and apply it to everywhere we go. Like, I'm going to come up with a hashtag tonight of, I wish I would have known, maybe BRCAStrong. And I think we should take that to the next level, and let's truly make an impact on your breast reconstruction options, whether it's VIEP, whether it's direct to implant, whether it's implant illness. We need to know our options. And I ask you ladies tonight, when we relaunch our website, to look at those options and share them with your family and friends. If it means that you just download our PDF and share it, or you share our link, we need to help and advise women to know your options, because I know if I knew my options, I wouldn't be headed in for number 9 breast surgery. We have to stop this. We have to make a standard, and we have to continue to make a difference. And that is my goal here at BRCAStrong. And I know by the end of 2021, I will have surgery, I will get my womanhood back, and I will get a bill or something passed. Women's Healthcare Act, Cancer Act by Wasserman Schultz. Yes, you deserve to have, you should have symmetry. You should feel whole again. Let's follow these laws. Let's follow these bills, and let's implement, and let's impact, and make every woman know their options. And that is my plan for my future of BRCAStrong. And I want to thank everybody so much for coming on tonight. It was a little difficult in the beginning. I finally opened up and shared my story. Many women don't know that I have chosen to have an implant taken out, and I faced major barriers with my insurance, but I'm lucky enough to have BRCAStrong, have a community of not only women in it, but also amazing physicians that help BRCAStrong be who they are today. I know without these physicians' dedication and time and commitment, my impact wouldn't be so high. But all of you ladies know on this call how important it is to know your options, whether it's breast cancer, whether it's ovarian cancer, whether it's cervical cancer. Know your risk, know your options. Early detection is key. What I'd like to do again is thank everybody for coming. I am available if